This time of year, allergies, hay fever, for the whole year round, allergic rhinitis, sinusitis, colds, flu, these allergens and or pathogens, they invade our breathing space, caused by pollutants, caused by pollen, caused by staph, streptococcus, microorganisms. What can we do about it? We know why, but do we know how?
Sinusitis is a common problem affecting some 8 million people in the UK at any one point in time. It's often associated with colds, flu, infections, pollution and allergic reactions. Nasal congestion can also lead to complications, including headaches, fatigue, throat and chest infections. MediCleanse Nasal Rinse with xylitol offers a safe and effective solution for all sinusitis sufferers, children and adults. So the need to find something that is safe and effective and provides respite from these conditions is paramount to maintain quality of life. Most of us will experience some form or other of illness associated with the air that we breathe in our lifetime. We're going to illustrate how, in one simple go, with natural, eco-friendly active ingredients, that the MediCleanse Nasal Rinse can reduce the symptoms of these debilitating and extremely distressing conditions. Saline alone is the traditional way of cleansing and irrigating foreign impurities, such as allergens and pathogens, from the mucosal lining of the nasal passages. Studies have shown that xylitol potentiates or increases the activity of saline, providing extra cleansing power to an already existing process. So how does the MediCleanse Nasal Rinse with xylitol and saline work?
I have dispensed into the bottle 214ml of boiled, cooled water. Also, there are the contents of the sachet, which is xylitol, saline and sodium bicarbonate. These are 0.9% alkalinity, which matches that of the human body. And what I've done there now is cleanse and irrigate the pathogens and allergens off the nasal mucosa, thus relieving the symptoms of allergic rhinitis and sinusitis, colds and flu.
Xylitol is a natural plant-based sugar extracted from corn on the cob using hydrochloric acid. This form of extraction is purer than the alternative version, and the process is eco-friendly. Xylitol has shown to have antimicrobial activity and is used by dentists, widely recognised as a natural sugar substitute. The pathogen that causes sinus problems, colds and flu, recognises only animal-based sugars and adheres readily to the nasal mucosa. This adherence or glue-like qualities is disrupted by the xylitol as the pathogen is not programmed to identify plant-based sugars and easily falls off the wall of the nasal mucosa in the presence of the MediCleanse Nasal Rinse. Using the MediCleanse Nasal Rinse will help protect the nasal mucosa from the invading pathogen and minimise the effects of a cold or flu. There is no such thing as a cure for a cold, but by regular nasal and oral care, it will reduce the chances of contracting respiratory infections. Dietary support will also help, and 2 oranges a day will considerably support the systematic defence mechanisms against the viral pathogen attack during the winter months in particular. In terms of the mode of action of how the MediCleanse works, we need to separate hay fever from sinus problems. It's generally agreed that the MediCleanse Nasal Rinse cleanses the nasal mucosa of all irritants. However, there is a time factor involved. The body's response from inhaled allergens and the release of histamine, which is the body's defence mechanism, comes into operation once it recognises there is a foreign particle that needs getting rid of. The xylitol saline solution acts immediately. Where the pollen count is high or the patient is particularly sensitive, regular twice-a-day douching is required. The patient's allergic response will often determine frequency of use. However, with bacteria, the adherence is far more effective and will need twice-a-day treatment for about 14 days, plus regular use as the symptoms gradually improve. By using the MediCleanse Nasal Rinse 60 kit with bottle, you introduce a triple whammy, destroying allergens, pathogens and air pollutants that populate the nasal mucosa, relieving the symptoms of allergies, sinusitis, colds and flu. Self-diagnosis and subsequent treatment will enable the patient, particularly in hay fever and allergic rhinitis, to adjust use according to the pollen count level or exposure to the particular allergen causing the problem. For patients particularly susceptible to sinus disease, colds and flu, we recommend using the MediCleanse Nasal Rinse a maximum of twice a day during the winter period to immediately ward off the pathogens that cause the problems. Limiting the effect of the pathogens keeps flu and colds at bay. Ideal for professional sports people to minimise breathing issues caused by colds and flu.